So, councillors, we do have quorum. We'll be starting in 2 minutes if everybody wants to start to take their seats. Okay, I'd like to call this meeting to order and ask that everyone in attendance please turn their electronic devices to silent or vibrate mode. And I'll ask if there are any disclosures of pecuniary interest. Councillor Gale?
Thank you, Chair. Item for consideration is COM 21-2018, the long-term care. My daughter-in-law works for long-term care. Thanks.
Okay, we'll have the clerk note that. We don't have any presentations, and we didn't have any delegations scheduled. However, we did have a request past the deadline. So I don't know, we have Mr. Stephen Seuss here in the gallery, so I don't know if anybody would want to make a motion to, Councillor Marshall, you're making a motion to allow, seconded by Chair Caslin. So I will call the question on that. All those in favor? And that is carried. So, Mr. Seuss, I think you know the drill. If you want to come up to the podium and then we can hear your presentation.
I'm really going to have to impress Councillor Rigby today. So my presentation is on the revitalization of community watches. And I chose social services and public health as the first point of destination because the whole idea that I have around it is the protection of vulnerable peoples. So basically, the easiest way to explain revitalizing the community watches is if you ever seen those stickers on the door years ago, and it said this house is a community watch house. So I want to revitalize that and encompass technology into bringing that back, but also under a city and region joint banner. So I just broke down some points. So what is a community watch? And it's also referred to a neighborhood watch. It's an organized group of civilians devoted to crime prevention within a neighborhood. And the aim of neighborhood watches includes educating residents of a community on security and safety and achieving safe and secure neighborhoods. However, when a criminal activity is suspected, members are encouraged to report to authorities and not to intervene. So I kind of came up with some ideas about what it does. And you know, it enhances public safety, it protects vulnerable persons, and improves the way in which we report emergencies. So part of the reason coming to public health and social services is it's going to need that three-pronged support between paramedics, police, and firefighters, which firefighters are on the city level. So under the old model, as I kind of explained already, residents previously had the stickers on their front doors identifying their house as a safe house, or as a member of the community watch or neighborhood watch, whatever term you'd like to assign to it. So I asked myself, how do we bring it back? So my idea is to encompass app development through various bids, smartphone technology, to not only bring back the community watches, but to bring community watches in line with the 21st century. So who would be our partners in this? Well, essentially, it would be a lot of partners across government. I named NRP, fire teams, paramedics. So the residents would be able to report emergencies in real time through a proposed Safe Watch app. When they see criminal activity unfolding, emergencies unfolding. And part of the reason is that because many individuals are actually, hesitant or afraid not to get involved or not to phone 911. So since we live in a technology where everyone's equipped with a phone, this is a positive because if you can report the emergency in real time, giving the three emergency services a notification, think of it as a smart cities concept almost. So I ask, will it be anonymous? No, it would not, because, when you call 911, they ask for you don't have to report, but we want to try to eliminate anonymous reports because those could be frivolous. So we would have to encompass that into that. But I do want to, in the app that I'm proposing, and again, there's a lot of app development companies out there that we can look at. I want to encompass a walk home program into it too. And like many colleges and university campuses, the app could be equipped with a walk home program. So individuals in the community could sign up to be walk home volunteers. This was something that Trent University had. If you're walking alone at night, you can sign up on the app and you can press where you are and somebody could come walk you home. The safe houses are the main backbone to this community revitalization idea. When an individual is in trouble, the app could identify where safe houses are, replacing the sticker on the door program. So you might be wondering, anyone could be wondering, are the safe houses safe? Well, part of that, I've thought about it, and people, I think, would be required to upload a vulnerable sector check to the app hosts. And by doing that, they would say, okay, like I'm free of a criminal record, I'm a safe person to be around. And so that's kind of something that I thought of. So in conclusion, what does it do? It enhances trust in the community, it encourages community safety, it lets us get to know our neighbors better, and it gets local and regional government collaborating more. So individuals who would be participants of this program might offer a wide variety of backgrounds. So the people who sign up to volunteer for this program, because it's completely volunteer, they could be mental health counselors, they could work as mental health counselors, they could be fire personnel, they could be even paramedics and the police officers, and they would identify their house as a safe house. So, a lot of people feel like when they're in danger, they're reaching out to social services agencies, So I think this is a good thing to have in the social services sphere. I think it puts Niagara, ahead of the curve. So I kind of had just a small motion here. If someone wanted to move it, it's fine. That Niagara Regional Council Public Health and Social Service Committee, in principle, supports exploring the idea to bringing back community watches through consultation and staff reporting. Of course, that the presentation be received for information, but I'd like the Niagara's 12 area municipalities to be copied on the presentation so that they can make their own decisions and conduct their own part of the research on bringing back this kind of 21st century community watch. And that's it. I hope I'm in time. Yes, I am.
Okay, thank you for the presentation. So we do have a speakers list for questions. Councillor Gale.
Thank you, Chair, and thank you, Stephen. Through you, I was going to press the button for a point of order because I think this is a police issue. And if you want, I'll provide through the chief's office someone to talk to in community policing. And if you wish to make a presentation of the police as a result of that, but talk to them first, you can make a presentation at police board. But I think this is a total police matter on what you want. So I'll just move on from there. Thanks.
Fair enough.
Okay, thank you. Councillor or Chair Caslin.
Thank you, and I'd like to make a motion to refer this to the police. As both Councillor Gale and I sit on the police board, I was like to make a motion to refer this to the police board for their consideration and to explore the opportunities, if that's okay.
Sure, I think Councillor Rigby is seconding that, so a motion to refer to the Police Services Board. So I will call the question on that. All those in favor? Opposed, if any? And that's carried. So there, you got an invite to the Police Services Board. Okay,
Can I leave the motion with the clerk?
sure. They have it. Okay.
Pardon?
They already have it.
Oh, they have,
Okay,
okay.
perfect.
All right.
All right,
Thank you.
thanks, Stephen. Okay, so now we're moving on to items for consideration. So we have COM 21-2018, the approval of the 2017 draft childcare programs and long-term care home annual reports. So if I can get a mover and a seconder, moved by Councillor Volpatti, seconded by Councillor Bentley. Are there any questions or discussion on this report? Okay, seeing none, I'll call the question. All those in favor? Opposed, if any, and that is carried. So now we're moving on. We had one that was pulled for a later date, so now we're moving on to NRH 10-2018. So if I can get a mover and a seconder for that, moved by Councillor D'Angela and seconded by Councillor Gale. Any questions or Councillor D'Angela?
Thank you, Madam Chair. Before I speak on the report, I wanted to take this opportunity just to announce, I know a press release has gone out regarding NRH's newest CEO, Donna Session. We look forward to, Donna's in the audience right here, so I know many of us are familiar with her and I've worked with her at different times. She's been the interim CEO twice. The search committee is quite pleased to announce her as the selected candidate. The board has approved it, so we're quite excited to have Dawn in that position. She brings extensive years of housing experience, her knowledge, and just well-rounded knowledge of the whole housing industry sector. So she'll be a great advocate for housing here at the region and a great person to work with. So we look forward to having her with us. So on that note, I just want to speak briefly on the report that's in front of us. This is a 12-unit affordable housing project that the NRH is moving forward as one of our owned units. This is one of the best good news stories that we've had in a while in terms of utilizing our own land. There was 4 units on this property that had extensive capital work that needed to be done. And through the process of NRH's tendering, we found that the repair costs were going to be quite extensive. So then we looked at a more holistic approach and how we can actually best utilize the dollars that we're receiving at Niagara Regional Housing. So what ended up happening here is staff took a great look at this, looked at what we can do being more efficient and more proactive. So the 4 units have now turned into 12 units on the same piece of parcel. We own the whole street along Roach Avenue, so this is a great addition to it. It fits right in, and it's going to be a wonderful project, and it'll address our housing needs here in the Niagara region. And again, it was a made in-house solution utilizing land that we already had. So those are the key points I wanted to mention, so it's a great project moving forward.
Okay, thank you. Councillor Rigby.
Madam Chair, I don't think that I need to say any more than what has been said. I think I pushed the button to make the second the motion, but I believe you have that already. Yeah.
Okay, so if there aren't any further speakers or questions, then I will call the question. All those in favor? Opposed, if any, and that is carried. So now we do have a presentation, so I'm going to invite Kathy Cousins, the Director of Homelessness Services and Community Engagement, to the podium, respecting a presentation respecting the COM 16-2018 Niagara counts.
Good afternoon. We conducted our second point-in-time count on March 27th. You may recall we did one 2 years ago. Why do we do a point-in-time count? Federal and provincial initiatives are asking us to do this to measure the extent and the characteristics of homelessness. It became mandatory for 2018 and will be every other year going forward. Our 2016 count was a voluntary count. We did apply for funding with the federal government. The maximum available was $50,000, and we were successful in order to fund the point-in-time count for this year. Over 60 communities have participated, which is substantially more than 2016. During our count, we received 408 surveys back, which is 26 questions that individuals respond to develop a characteristic or a profile of what homelessness looks like here in Niagara. You did have to be 16 or over to participate in a survey, so this does not count our children that are also in shelter. We did our count a little different in 2018. We took the learnings from 2016 and expanded on it. So while we did do a sheltered count, which is all of our emergency shelters, the violence against women shelters, and our transitional housing, we did again a street count, but we also did what are known as magnet events. So we had 3 events that were targeted to specific populations to encourage individuals to come out on that day. They would get a meal or any other offering that was available on that day. They'd participate in a survey if they wanted to. But in addition, they also had an opportunity, if you were only at risk of homelessness, to understand the services available to you in community. We had special teams this year. These went into hard to reach areas, encampments that we were aware of that our traditional volunteers we would not have for safety reasons asked them to do that in the past. And we did have CMHA as part of our broader system participate, so their Safe Beds program, where individuals had identified as homeless, participated in the survey as well. There are 2 elements to the count. There's the true enumeration, which is just the raw count of individuals who were homeless on that 24-hour period. But in addition to that, it's the survey. The survey information will be submitted to both the provincial government and the federal government to inform their planning going forward, and then every 2 years to help them identify trends. In Niagara, we will use that same data to inform our local planning, but in addition to that, we will also compare ourselves to what we believe are comparable jurisdictions because it was mandatory in Ontario. So if there's some data elements that we want to see, well, what did your profile look like compared to ours? We have the opportunity to do that. I always do this. Thank you. I need to do a big thank you actually right now to the 87 volunteers that participated on the day of the count. Yeah, it is a substantial effort. We could never do it on our own. So we had 87 participants that day. You have to be 18 or over to participate. We use social media to do the attraction. And it's more than just the count. You have to go to mandatory training to understand how to deliver the survey, how to answer questions if somebody asks for interpretation. There's some safety and logistical training. So it's more than just a couple-hour commitment that we're asking of people. So 87 was a really great number. The volunteers work in the shelters to get the surveys done. They do the street counts, and they helped us man our 3 base sites. We had 1 in St. Catharines, 1 in Niagara Falls, and 1 in Welland. So as I said, the count was March 27th. One of the questions we asked are, where are you staying tonight? As you can see, most people were staying either in an emergency shelter or transitional housing. So that is the bulk of where our survey responses came from. We actually had an 80% response rate to those areas for the survey, so we were pretty happy with that. In participating in the survey, individuals received an honorarium. It's just a small token Tim's card, but something for taking the time to participate. It is 26 questions, so it's a length of time that you're committing. And again, I need to do one more thank you at this point because Cadbury's came through for us and gave us chocolate bars to give out to everybody who participated that evening. One of the things we'll talk about right now is the age characteristics, because that is something we saw a change in from 2016. Our youth population stayed almost exactly the same. However, all of the other age categories seem to have slid a little bit into that 31 to 49-year-old category. Currently, we do not have an evidence-informed explanation for why that shift has happened. We are looking into it, and we look forward to talking to our peers out there to see if this is something that others are seeing as well. But that was a change that we experienced here in Niagara. Education. We've given you here the 3 buckets of less than high school, and more than. In our count, 38.5% of that client population did not have a high school diploma. The normal in census data for Niagara would be 18.2%. For high school, again, we were 25.2% with our survey. The norm in Niagara is 31.2, and greater than high school, we saw 36.3, and the norm for Niagara is 50.5. On the offset to that, I will say that that also means that 61% of the population we surveyed that evening did have high school or greater education that were staying in a shelter or transitional housing. We asked people what the reason was for their housing loss on that evening. The number one reason was family breakdown. The second is financial, which can be job loss, but it can also be you simply can't afford your rent or your mortgage. The third reason, addiction and substance abuse, unsafe housing conditions, which can include even structural issues right through to bed bugs or pest issues. And the fifth reason was an illness or a medical condition. You were allowed to pick more than one reason in the event you had more than one reason, so it does add up to more than 100%. The other piece being that on our respondents, we did ask their source of income. Almost 80% the source of income is social assistance of some kind. Health. We asked people what their health concerns were, as well as what they felt they needed services for. As you can see, their health concerns they identified as mental health, addiction, a medical condition, or a physical disability. Again, the respondents are self-identifying what they believe are their medical issues, and we're allowed to select more than one, so yes, again adds to more than 100%, but it does again help to tell a picture of what the individuals in shelter believe they need from a system. And when we speak about the system, 55% of our respondents did say they had been in shelter more than 6 months within the past year. Another 16% said they were more of an episodic nature. They'd been in and out 3 or more times. But when you look at the broader system of services that we provide to community, and you look at the number of visits, and here we have, again, self-identified, their visits to an emergency room, their days in hospital, their interactions with police, their participation in jail or prison. You can see that an individual who finds themselves homeless has a lot of interactions with the broader human services systems. Some other data we wanted to bring to your attention. This chart is attempting to show the changes in your income. As we said, 80% are on social assistance versus what you're seeing as far as vacancy rates and average market rents. So the vacancy rate in 2014 here in Niagara was 3.6%. It's down to 1.5%. The average market rent for a bachelor was $586 in 2014. We're now at $642. A one-bedroom went from $745 to $822. So as you can see, if you're an Ontario Works participant at $721 a month, your purchasing power has significantly declined since 2014. I think the other thing to note is, and it was in the media recently, that PadMapper has noted that active listings within St. Catharines, which again, it's only the listings that are turning over, has gone up 15% for rent within the last year. Some other data we wanted to point out, because we know our numbers are larger this year than they were in the 2016 count. It's important to note that the number of unique households that have accessed the shelter system has not really changed between 2015, 16, and 17. What has changed is their length of stay in shelter. And that's what creates the bottleneck, and the fact that our occupancy within the shelter system is increasing, and the bit of a bottleneck that we're experiencing within the shelter system. We believe that some of this, of course, has to do with vacancy rate, price of apartments. It's difficult to exit if you can't find something that you can afford. So what has Niagara's response been over the last couple of years as we've watched this? We have 21 fantastic agencies that are delivering services for us in the areas that Council has prioritized. We also have our Housing First program, which has really only come into its own, I'd say, in the last 18 months. But currently, of the 168 units that we are authorized for, we have 143 being used. So it's definitely maturing. We received, as you know, Home for Good money from the province in the late part of 2017. We had 40 community units that came with that. 23 of them are now being occupied. That would have happened largely after the point in time count. In addition, we got capital money for 28 new builds, and as I stand here, we have demo permits and construction is starting. Those will be supportive housing units and deal with some of our more chronic cases that we're seeing with length of stay in a shelter system. Some other things that we're doing a little bit differently to try to address some of our pressures. We've engaged as a pilot project a landlord engagement specialist, a firm, for 2018, specifically focused on trying to find landlords that are willing to continue to work with us or new landlords that are willing to offer us units. Only attached, though, to the Housing First programs and the Home for Good programs, because that's a scenario where we can give some confidence to landlords because we are providing supports and are regularly going into the units. Another piece we're working with that was part of our proposal for Home for Good is we have partnered with our public health friends and their mental health group to create additional services for mental health and addictions that are available to that Home for Good clientele. Other initiatives, modernization is the language that the province is using and the federal government, but the federal government is moving us forward to what they're referring to as a by name list as part of their new funding, where we actually have a list of who are the participants in a shelter system, and then they also rate their acuity to better understand and make sure that we're mapping the right people to the right programs at all times. So we're working on that. Our common database has been launched. I'm actually quite happy about that because it is going to be a requirement in April of 19 to be on that database to receive federal funding, which we do here in the Niagara region. We're doing a shelter system and a homelessness system review right now with a third party to benchmark us to other jurisdictions, not just in Ontario, but broader than that. They're looking in Alberta and the US as well, to understand where we're best practice, where we have gaps, and what are our opportunities to improve our system, particularly as we lead into the next round of expressions of interest that'll happen in 2020. And we're doing some policy reviews. We're working with all of our agencies right now to increase or improve our shelter policies, to better understand what the rules are in shelter, make sure everybody's participating the same way, and also to offer training to create consistency within shelter offerings. And one example I'll give you is we did offer trauma-informed care. It was 6 full days. You got a certificate at the end, and every agency we're invited to send a few staff, again, to address what we're seeing as the more complex needs, as you saw that slide about health and how individuals are identifying themselves. And questions?
Okay, Councillor Volpatti.
Thank you very much, Chair, and thank you very much for this report. It's very informative. It's very depressing in many ways because there's such an increase from 2 years ago in the number of homeless. So I just have a few questions. Number one, I know you didn't count hidden homelessness. Obviously you can't, but what is hidden homelessness?
The definition of hidden homelessness is broad. It includes individuals living rough that you may not see, and we did try an attempt to identify those. Our first responder friends helped us to identify where encampments and that were, along with our own outreach programs. But that also includes all your couch surfing individuals, or people staying with friends, or people that may have a hotel room for that weekend, or week, but we aren't aware of them as a homelessness individual. So our number is never going to be fully representative of the homelessness population.
Right, so it's maybe on the low side, it's never going to be on the high side.
Correct.
The other significant part of this is the age group 31 to 49, and you've said that you don't really know why that's happened, but you're looking into it. Any insight into why that age group seems to be targeted at this point?
Anything I could offer through you, Chair, would be anecdotal right now. Even the agencies, we need to sit down and brainstorm a little bit on that one and make sure that we understand it and are not overlaying something that comes to our mind on a population. We could be wrong.
Right. And as far as the increase in the number goes, you said that some of the explanation is vacancy rates and high prices in the market in general. What else can you attribute this increase to?
Some of it, again, this is anecdotal. These are thoughts and conversations with executive directors at some of our agencies, but I think you could attribute Some of it too, people have challenges. And when they present, I mean, you saw 50-some% are suggesting that they have mental health issues.
Right.
So their challenges are keeping them in shelter longer. It's also very difficult in this vacancy rate. You know, you put an apartment up, you're going to get 10 people that, you know, are going to arrive, like my son, with a mom beside them saying, yeah, I'm here, I'm with them. And you're pretty guaranteed as a landlord then of a safer tenant. When we're sending somebody who's on Ontario Works that may not be able to make the rent because they know they only have a little bit of play money left between that rent and, you know, there's the risk of arrears, it's a difficult choice to choose that client when at 1.5%, you've got a lot of options.
Right, and without incentive, why would you go with the one who's not as stable? The thing that really speaks to me in the whole report is the multiplicity of needs. These are complex needs of these individuals who are looking for housing, who need housing, and who haven't been able to find it. And whether or not we have a system that's integrated enough to provide that kind of care. Can I have your thoughts on that, please?
Through you, Chair, I think the one thing I can offer is Niagara is not unique. We are hearing this from all of the urban commissioners and homelessness, that there's this complexity of needs and concern around that. I can assure you that provincially we are having that conversation with the ministry as well about how do we do better alignment with the Ministry of Health, because most of the mental health programming comes from that side. I can also offer that I do sit now at the anchor table for the planning for our local health integration network, and homelessness and health equity is a topic that they are interested in. We also have a group from the Niagara North Family Health Team that are interested in expanding services directly into shelter for us, which will put a physician directly in shelter for those who don't have a doctor or even struggle with getting to the appointment. So we have a number of local initiatives. I will say our local health community has been very supportive, and we are working on one more initiative with our friends over in public health and mental health as well to work more closely with the shelters.
Right. And so those who are looking for housing may have, and quite often have, health needs, social services needs, from community services and social services. They have a whole spectrum of things that need to be taken care of. And what I find, or what the stories that I hear, is that they apply for help in one system and don't get the guidance that they might need to get help from several systems.
Through you, Chair, I think a couple things I can offer around that. The province is moving towards what they're calling human services integration,
Correct.
which will speak largely to the social assistance piece, the housing and homelessness piece, and childcare. Locally, we're trying to actually expand that slightly to also include elements like our seniors community programs, where you have people that are even 50 and older, because their health needs are more compromised in a homelessness environment. They can access those services earlier. We are, as I said, working with our health partners internally and externally to also try to get that integration going.
Right, thank you. And as far as HSI, I'll call Human Services Integration, is concerned, because the province is moving towards that, we're not there yet. Do you know of any other jurisdictions in Canada or otherwise that have completed this HSI progression, so that there is an integrated system to take care of those with multiple needs?
I think there's a couple elements to human services integration, and I think your focus is more on the homelessness perspective, whereas the province is looking at much more broadly. They're
Correct,
also
yes.
suggesting that you should be able to present, I'll pick at Campbell East on this moment, and be able to go to one person and have a conversation that is, you know, your tombstones and information is put in a system.
You tell your story once.
Once, exactly. There's other opportunities around homelessness and housing that people have integrated. There's opportunities I mean, when you think even about childcare and homelessness and housing, I mean, we have children staying in shelters. So there's lots of opportunities
Right.
about how we put this package together. Uh, There's a restriction a little bit right now around freedom of information too.
Yes.
And roadblocks along the way.
But do we know of other provincial systems or systems where human services integration has actually been accomplished?
I would suggest that across Ontario, there is a range of
Outside of
jurisdictions.
Ontario, because Ontario is
okay.
moving towards that.
I don't know that I could comment
Okay,
outside of
thank you.
Ontario on a firm solution.
All right, thank you. I'm just glad for the movement, happy for the movement, because what I find is when someone calls me for housing, and for some reason he can't be accommodated in housing because he has a previous history of not paying rent, for example, which is not a good history to have. But if you have somebody who's seriously mentally ill, they are not going to be able to use other systems in order to solve their problem. So they get lost in the maze of a fragmented system. So thank you very much. Thank you again for the report.
Okay, thank you. And before I go on to the next speaker, I just want to get the report out on the floor, just in case we kind of go back and forth between questions and comments. So moved by Councillor Rigby and seconded by Chair Caslin. And then I will go to Councillor Height.
Yes, thank you. Through to staff, one thing that should be emphasized, and if you can go back to the education graph, if we could look at that for a minute. Have we compared that kind of a graph with other communities that have done this last term or when you did 2 years ago? How our numbers compare?
Through you, Chair. The data is not required to be complete and submitted to the province until September. So a lot of our counterpart jurisdictions at this point haven't finalized their data or made it as public as we have. We will absolutely be doing that once we can get a good handle on it.
Back through this, the presenter, 2 years ago when it was done, are our numbers similar? That 38% just jumps out at us saying, get a better education. We have to be pushing that, because if you're better educated, you don't end up in the services that are required that we're looking at here, that 38% don't have high school education, and you're saying 18% is the norm in Niagara. So we're seeing that if you're not educated, unfortunately, you're ending up being one of the homeless or one of the ones needing all the services.
Through you, Chair, I was half looking at Christina to see if she knew the number from 2016 that didn't have high school, and while she's trying to look that up, the other piece I will say is, you may recall I've come to you with a youth homelessness strategy, and that is a big piece of why we want that strategy, is to engage students before they exit the education system and try to keep them in school, so that we prevent homelessness on a futures basis.
Well, that's critical, that we have to get that story out there, that keep kids stay in school, get your high school education and go further, because it will help you obviously in the long run. Another question regarding out of the cold program. This was done in March. The numbers were done in March. So were you in the out of the cold facilities to get most of those people to fill out your survey?
Through you, Chair. Yes, the Out of the Cold program runs till April 15th. We specifically time our point-in-time count to ensure that we can include all of those clients in our survey.
Okay, then a follow-up question. We know on any given night, and some counselors know better than I, but they've reached out to me, 75 to 100 people in St. Catharines are using the Out of the Cold program. Where are they after April? Where do they go? Because we have this issue. We know that they're using what's available during the winter, but where are they after wintertime, after the program shuts down? Because that's a major concern of all of ours.
Through you, Chair. It's always interesting how people tend to find places as they know that program is ending. Anecdotally, we've also heard that some of the participants in that program, some of it is for social inclusion. They actually do have a place to stay. But, you know, they come for the meal, they stay for the evening. We do end up placing some people at the end of April 15th. They are not successful in finding another place to go.
Okay, a follow-up, and one of the organizations reached out to me because they're telling me they're stretched to the limit. They aren't sure whether they're even gonna run the program next winter. Number one, volunteers, safety, et cetera. The fact that twice as many people show up for dinner that stay, and should we not just be taking care of the people that are really in need, that need a place to stay, and not just feed people just because there's an opportunity to get a meal? What are we doing about that? Because winter's gonna come in another number of months. We're gonna have this problem, especially if some of these organizations, churches say, we can't do it this winter. What are we doing to address that homeless group now before winter comes?
Through you, Chair. We actually have meetings at the City of St. Catharines with our provider for Out of the Cold tomorrow afternoon to have some conversations about opportunities with them. I have meetings Friday afternoon at the City of Niagara Falls with a number of agencies. They have an interest in attempting a pilot project for this winter coming up. And we're also having conversations with one of our traditional providers of emergency shelter about also participating in some form of an overflow or additional program. And I believe they're working on a schedule next week to meet with the churches as well to understand what we could do to make them more comfortable with that program and who, if any, are willing to participate going forward.
Okay, and a follow-up question, and I think I'll address it to the Ms. Jugley. Have we ever pursued, and again, this is brainstorming, there are commercial properties in Niagara, large, that haven't been rented. I drive by them from time to time and you see this large location that could conceivably be built for the winter temporarily for 6 months, and then have everyone involved helping in one location instead of moving it around in St. Catharines. I'm sure Niagara Falls and Welland have the same. Has that ever been considered, that when we meet with these organizations, that we try to do something at least during the winter when these people are desperately in need of somewhere to stay? And that doesn't solve the homeless. That just deals with it at wintertime. I know that.
So through the chair, I mean, I can't really speak to history, but I can tell you that from our other responsibility, which is emergency shelter services, we are always keeping an eye on available buildings for emergencies, so even sort of large-scale emergencies. One of the challenges is that you need certain things in a building in order for it to be safe for people to stay in overnight, and including bathroom facilities and to some degree even kitchen facilities. So part of the purpose of our meeting actually with the City of St. Catharines is to understand what opportunities exist in that community, since it's that community that's signaling to us that they have some concerns for the upcoming winter. That all being said, I think we also need to continue to have conversations with our current shelter providers to see what other resources or opportunities are available with them as well. So we have 21 agencies that we work with for a range of services. If we were faced with a situation where one of our providers is signaling that they're not able to continue offering services, I would want to go back to our system to see what recommendations they have, and we're in dialogue with them now, just in case that's an issue. Including being able to up the level of service over the winter months. I think that one of the things that does become challenging is things like insurance and cost in buildings that are maybe not designed for that purpose. And so we are looking at every possibility, absolutely. In the meantime, I mean, Kathy, Director Cousins was signaling some of the other work we're doing. We're working with our providers to try to address this pressure in the system currently, because we really believe that our main focus has to continue to be housing first, home for good, rapid rehousing, getting people out of the shelter system. And the shelter system should not be seeing the length of stay that we're seeing currently. They're turning into transitional housing, and that's not something we want to support. So we continue to look at those other strategies as well, but we're on it full court press for sure, so that we have a solution for the winter if there's any changes.
Well, that's good to hear, because obviously I've reached out to you because they've reached out to me in a number of cases. I saw someone this weekend and they wanted to chat again about it because they're that concerned about this winter coming up. But the last comment I might have is, Kathy, you mentioned about the fact of chocolate bars, and it was a nice, or Cadbury, have we reached out for corporate funding? Because these organizations, the churches, et cetera, is coming out of their pocket for the food. Have we reached out corporately to companies to help us help them with their winter programs with food, et cetera? And if we haven't, we should be helping facilitate that. So.
Through you, Chair, we have not reached out. We fund, but we do not participate in our agency's fundraising that they do external to us.
Okay.
Okay, Chair Caslin.
Thank you, Madam Chair. It's important information that we're hearing and that we have in this presentation. And I know this report is simply to receive today, but I'm going to ask if we can refer this to Committee of the Whole on Thursday to add to our deliberations related to our service delivery model for our regional client services. Can I ask for that to happen, please?
So referring it to Committee of the Whole, so seconder, Councillor Wolf-Patty. So I will call the question on referring it. All those in favor? Opposed, if any? And that's carried. Okay, so now we'll move on. I think we can move the next three reports in block, and then if anyone wishes to speak to them, we can do that. So can I get a mover and a seconder to move 6.2, 6.3, and 6.4 in block? Moved by Councillor D'Angela, seconded by Councillor Beatty. Any questions or discussion on these? Is that Chair Caslin? Or is
That's
that
left over.
That's left over. Councillor Rigby, got a. Oh, I'm sorry. I can't.
I just wanted to comment on the last report, which I know that sorry, I didn't have that on. Better take this off. That to the Homeless Initiative Committee, this was a piece of information that's going to be very helpful as they continue to strive to find some alternative answers in working with our staff. And also, the numbers that we look at, there seems to be a continual change in people that are using, in fact, during the summertime, breakfast programs that are run in St. Catharines, and I'm sure in other communities. And at times the volunteers have the feeling that these are people that come from other jurisdictions and come for free breakfast. I'm assured by Ms. Jugley, the Commissioner Jugley, that really isn't the case. They can't afford to take the bus to get here. But there is a transition going on of younger people, and at times it's been a little more of a concern to the volunteers that provide those services. And I know there's a lot of good work going on through the different programs to assist in looking at how when you're welcoming people into your facilities to provide breakfast or provide dinners in some cases, that there's more interaction that is needed when you open your doors and you welcome people in. And that has had some success, and it's a matter of communication in many cases. So this just shows you there are people there that in that chart where you have that percentile of non-high school educated kids in particular that probably haven't been able to go forward because of their family situations, etc. And it turns out to be good communication. And the other, of course, is that they are, in many cases, when we say they're health issues, and it's very much mental health is showing up as is in the report. So I just wanted to comment on the excellent work that was done and the work of the volunteers that went out and did the interviews. And hopefully in another 2 years, we'll see a downturn in the numbers that we have to look at, but I think that's a very broad hope. Thank you, Madam Chair.
Okay, thank you. So back to the reports in block. So Councillor Height?
Yes, CWCD 218, 2018 opioid work update. A question to Dr. Feller regarding the issue. I've noticed just lately regarding some of the professional sporting organizations are starting to look to medical marijuana as a solution to opioids. Are we starting to see that in Canada, that there is going to be a push to medical marijuana versus opioids to help solve that problem?
Through the chair to Councillor Height, thank you for that question. I mean, marijuana, both recreational and medical, is something that comes up increasingly in relation to the opioid crisis. Unfortunately, on the public health side, what I would say is that's really an addictions treatment healthcare question around policy level as well as individual decisions. On the public health side, and I think I've mentioned this at a prior committee, is that we do not recommend going down the path of one drug to substitute for another. And on the public health side, where we will focus our efforts in collaboration with the healthcare sector, who would speak to this question that you've raised, Councillor Height, through the chair, we would focus on the 4 pillars with the overdose prevention network, including harm reduction, getting folks into treatment for opioid and substance misuse issues, and most especially on the public health side around prevention.
Thank you.
Okay, thank you for that great answer. Councillor Beatty?
Yeah, I'm looking at the report dealing with alcohol use and drug use and so on with elementary and secondary students, PhD 12, 2018. As a former principal and as a grandparent, it concerns me what the data says, but I think it would be even more helpful to people in the educational field or guidance or whatever if there were numbers associated with it that said a plus or a minus in terms of compared to the year before. In other words, the trend in terms of the issues. And the question I would have is, to what extent is this information distributed to people in the educational field or people working with youth, et cetera, to try and basically attack the numbers to try and bring them down? In other words, the outreach.
So thank you, Madam Chair, and thank you to the Councillor for the question. We certainly do have some of the data on past numbers, and we will sometimes present both of those together. In the appendix that you're provided with the report, we are just presenting the current numbers just because the volume of numbers would have been too much. To the question about the work we're doing with the education sector, that is actually one of the priority areas. And for example, one of the elements that we did with the data from this report was actually to use it in some of the grade 6 and grade 8 teaching that we do within the schools around substance use, around building resiliency to mental health issues, etc. So we definitely are using it within schools through our own school program as well as through other educators in the schools.
Could I ask, is there outreach to like parent councils and so on, like the parent community?
Madam Chair, I'm not familiar if you've reached out to parent councils per se. We definitely did do some social media work to try and get this information and this message out more broadly to the public as well. I'm going to look to our manager in chronic disease injury prevention if she can comment at all on the parent councils element. Lindsay Gruffalo.
Through you, Chair. Great question, and we've definitely taken the approach of sharing with the general public. We've done some information sharing through social media, but it's a great point about potentially targeting parent councils as an audience to share some of this data with.
Okay, thank you.
Okay, so seeing no further questions, then I will call the question on receiving these for information. All those in favor? And that's carried. So now we are on to other business. Councillor Gale?
Okay.
Yeah.
Thank you, Chair. And I want your guidance on this and direction on this. Yesterday, the police board did a tour of a marijuana growing facility. I won't say where it was in the Niagara region. And as we know, there's 3 or 4. Chair Castle and myself and the board members who were there. And I looked at it from a different avenue because there's been so many complaints from various areas in various communities of the smell coming from these places and the light at nighttime coming from them. I know there's a prominent individual in the area here that has complained about it and was been guided to go to the public health department to complain, be it the region or even this person said he was guided to go to the province about this. Now, I'm not sure if this is a planning issue or a health issue, but because of that guidance, I bring it here. And I see the chair of planning is Councillor Volpatti. When I was talking to the lady who was the manager of this plant, I said, I'm here from a regional councillor perspective on this. House values are going down, or perceived to be going down. I'm sure they would be, because of the smell from some of these growing facilities. And also, I remember driving through Niagara Lake one night, and I thought there was a fire around Concession 5. It was about 10 o'clock at night, and the lights were shining up, and that's because we were told that they need, correct me Al on this, 16 hours of sunlight a day, and certainly in the wintertime, they might not have that. So my comment to you is I'd like a report, and I don't know if your guidance would be planning, but I bring it to you because this person was directed to health on, my question to this lady was, your plant does not smell. And I didn't smell anything coming in. Now, was the wind going the wrong way? Was whatever. And I said, no, you won't smell it around our plant. And the lights at nighttime, you told us that you have other ways to handle the lights. You have covers. And I said, so are you telling me that the other ones aren't efficient operations? Maybe that's a hard line to use, but I know I live out in the country, and at any time a marijuana grow plant could be put beside my place, and I might be hating the time that is approved. So my question is, can we have a report, or this is where I turn to you for advice on this, on our measures by the municipalities possibly, or the region controlling these things not good enough? Is the province not good enough, or what? Because I also asked, do we have most of the plants down here? And they said because of sunlight, because of the workers. We have more, it's the word migrant workers down here that they can utilize and things like this down here. So they're mostly here. Now, there are the other ones in the province. So I'm looking for some guidance on a report on this before we have more spring up and we don't have any control on the smell going over. Because I heard there was one, and Mayor Augustine might be able to help me on this, but I've heard there's one in Pelham that sometimes you can smell it in Welland. If I'm wrong, I'm wrong. But, you know, that's house values going down. And so I'd like to go further than just a comment now, but I'd like a comment now if the doctor would like to, or anybody. Thank you.
So, Madam Chair, thank you, and thank you to the councillor for the question. This is certainly a concern that we are hearing more and more from others. I think you've correctly identified there may be some planning issues around this in terms of zoning of where they can do this and distances from residential areas. The other jurisdiction where this falls would be with the Ministry of Environment, because they would have regulations controlling how much noise and light and smell can be emitted from any particular facility. It is for the most part not really a health matter unless, you know, those emissions became so large that the Ministry of Environment would refer it to us for assessment of whether or not there is some health impact from this. So I think the question is best directed to both planning as well as to the Ministry of Environment to get some feedback on your questions.
Okay, Chair, then the person that complained was, I could find out, this whole conversation was yesterday afternoon, and I said I'd bring it here. Complain, and they said go, and I believe it was the ministry's public health department, or the ministry's health department about this. But people are getting bounced around on this, and I bring that to the forefront because I know in Grimsby, there's a new high school going just down the street from one out there. Okay, so do we want the smell to go there if that one did it? I'm not saying where we were, but you know, I think there's got to be controls, and maybe this is something that the provincial government or mostly federal government can go. I mean, certainly this has gone too fast. From a policing issue, the enforcement of it, this is ridiculous. The Chief of Police Association that is trying to get the laws in place, there's not controls on this stuff, and I know it's coming into effect in October. I'm venting right now, but I know the doctors just mentioned 2 organizations that we should go to. I've talked to somebody else is going to tell somewhere to go. So how do I'm not knocking you, doctor, I get it, but the citizens are being bounced around here. I get it, Ministry of Environment should control it. I think that's the one that should be doing it, but what happens if it's a health issue with this new high school going in your city? Now, what happens if the smell from that one, and I'm not saying it makes a smell, but what happens if that comes over to that high school and you're going against the day that you ever built high school near there, or we allowed this to happen. So should we as a region, and I turn to the chair of the region for this as well, should we be looking into this to see if we have more standards for this? Or should the mayors get together and say, we gotta have better standards on this? Because the biggest one I've heard complaints about is in Pelham and the smell going so far. And maybe they have the legal right for that, and maybe it's our fault for that. But I go to the windmills from before where you're a guy enjoying your property and the guy next door is making a lot of money on it, and you got the smell, the sound of the whoop, whoop, whoop at times. What's right on this stuff? And I think whatever we're doing is wrong now when things are coming. So can I get a report, or should I be going to planning or whatever on this? I need staff to look into this farther than just telling these people now go here. And then I get another complaint saying they went to the Ministry of Environment, they said nothing to do with us. Chair, I'm looking for guidance, please.
It sounds more like a planning issue. I know with what we've had to deal with in our municipality, it always tends to fall under planning, but a lot of people have been reaching out to local MPPs, because as you mentioned, with it being a federal issue, and I see Councillor Augustine is next to speak. I know I spoke with the MP that he and I share out in our riding, and I know he's been addressing concerns, so I'll let Councillor Augustine speak to that, but maybe we'll hear a little bit more, and then we can see. But I would say it's personally more of a planning issue, because we've been working on things at my municipality to try and be ready for any more grow-ups that are coming into the municipality. So Councillor Augustine, I'll look over to you.
Thanks very much, Madam Chair, and I certainly appreciate the councillor for raising the issue. We have we have 6 facilities that are licensed, but 2 of them are quite large. One of them, we have been receiving numerous complaints of smell since January, and they spiked in February and they've continued. The other one, there was some issues with light pollution, I'll call it, that the councillor spoke about. That was the other facility. I've toured both facilities. The one in terms of the light pollution, that's on Regional Road 20 and at Balfour, they've addressed that. They have curtains, blackout curtains now that they're using, and they don't really have that much of a smell issue. Although I think when Councillor Beatty and I drive home that way, we live near that facility, you can sense something, but not as pervasive as the other facility. The one on Foss Road is pervasive in terms of that smell, and it's going into urban areas, neighborhoods, in Pelham, in Fonthill, and also in Welland. And I know the Mayor Campion and I have spoke about that. We've talked to Dean Allison, the MP for Niagara West, Vance Badaway, the MP for Niagara Centre. The reason we're speaking at the federal level is because these facilities are regulated by Health Canada. Town council just adopted a resolution last night about this, and asking Health Canada in very, very strict terms to use the powers that they have to enforce the regulations that they have and that the federal government gave them. So just to quote from it a little bit, Madam Chair, it says, Section 61 under the Access to Cannabis for Medical Purposes Regulation requires that areas within a site where cannabis is present must be equipped with a system that filters air to prevent the escape of odors. That's their must. When they sign that license, when they get that contract, when they work together with Health Canada, that's what they have to do. In the case of that one particular facility, they're not doing that. And we have been strongly encouraging Health Canada to fulfill their role in this, to enforce, in essence. They've been, I'm going to say this, they've been lax in their enforcement. I know Mr. Badaway has been very, very strong, as you know he can be, in his opinions on this, and that they need to enforce it. It is with Health Canada. Our council approved this motion. I'm hopeful that Welland Council will approve the motion. It is being circulated to all the area municipalities, but it is regulated by, the odor issue is regulated by Health Canada. there were questions last night by members of council about what happens when the recreational component becomes legal in October of this year, if that date stays. It will be an issue, as the Councillor Gale pointed out, but we were dealing specifically with this odor issue. In terms of planning issues that the councillor also asked about, municipalities, I understand, treat them differently when it comes to zoning. Our municipality treats it as an agricultural operation. It's no different in a sense than growing cucumbers in a greenhouse. And they have to fulfill those rules in terms of minimum setbacks and those types of things from adjacent properties. They have additional requirements that are imposed on them by Health Canada in terms of security features, which may increase the distance that they're separated. They also would have to fulfill what's called normal farm practices, which are regulated by the province. But that's essentially the zoning component. And our our building officers, our building officials, chief building officials, also inspect the facility to make sure that it's constructed properly and it's not going to fall in, but they also have to fulfill Health Canada guidelines. So is it a planning issue? Partially. Some other local area municipalities may deal with it differently in terms of how it's zoned. Some, I think Niagara Falls said not in this area and put it in industrial areas. Others like Niagara on the Lake, I understand, say it can go in agricultural areas. But there are folks in Niagara on the Lake that are saying there should be increased setbacks. So I hope that helps the councillor. It could be a planning issue. I think it could be a discussion that we have across the region to make sure that there's consistent guidelines when dealing with it in a planning issue. But again, I think we should strongly encourage Health Canada to follow up and use the enforcement process that they have so that area residents aren't negatively impacted by these odors that are emanating from a facility and maybe other facilities that aren't following the rules that they're supposed to follow. Thank you.
So Chair, I still have the floor, I hope. May I respectfully, through you, ask the Chair of Planning if you'd consider addressing my point tomorrow and have a report at a further meeting, taking into account everything we said, because it sounds like it's more of a planning issue, but you get the whole gist.
Right, yes, I do. And I will address it with the commissioner and we can introduce it tomorrow. Thank you.
Okay, Councillor Beatty.
Thank you, Mayor Augustine. Councillor Augustine gave most of the background in terms of Pelham, the concerns that are there. This is a work in progress, and I really welcome the call for a report. I know at the Escarpment Commission, we had done a look at what will we do when and so on, and the discussion, not formal policy, was basically industrial areas. When it came to a push and shove of one of the ones in Pelham, that's off Effingham Street and so on, the bottom line came up, and what's the difference between Gerber daisies and cannabis? I mean, basically it's an agricultural activity. I'm seeing in Hamilton that they're looking at setbacks and so on. So different communities are attacking it in different ways because there are no set rules. The one on the day Dave and I drive by on our way home is going to be 1 million square feet in terms of operation. The former Gerber Daisy operation was, I think, 500,000 square feet. So that facility is doubling. Every home on Balfour Street abutting that property went up for sale. Some of them have taken off since then. It's a case where public is concerned, and I think they need to have some very early discussion, maybe too late in the game, in terms of such things as odor, such things as light emission and so on. This one in Balfour, when I went to a science fair in St. Catharines Collegiate earlier in the year and was coming home, and it looked like there was a Martian landing happening over Fenwick because of the orange, there was a low cloud cover and so on. I'm glad to hear that that's been addressed, or at least partially addressed and so on. But there are big issues that the community wants to go. One that I would like to have, I don't believe is public health, but it is Health Canada. But a public health issue, one of the major concerns, I'm really surprised at the number of cars at this facility at Balfour. There's got to be 200 cars there on a daily basis. And I would like public health aspect of this is long-term exposure by people working in the industry in terms of what safeguards should be in place for them and their health. That to me is a justifiable item for the public health to be concerned. The rest of it, I believe, is more in planning, and we need the larger levels of government to come to the front, because this shouldn't be a piecemeal, one community after another Should be something that's it's a national issue, so why don't we approach it in that same fashion? Thanks again for the call for the report.
Councillor Redicott.
Thank you, Madam Chair. On a side note, I think the long-term implications are perpetually mellow personalities. I'd like to come back to an issue that Dr. Hergy and I discussed at the last public health meeting, because this was an issue last night at my municipal council meeting, and that is the testing of water at Waverly Beach, which is one of the three main nodes for potential development in Fort Erie on the waterfront. And one of the questions that was asked by one of the councillors was the relationship between the water testing, which he understands is primarily for E. coli, and algae. So I'm wondering what the relationship is.
Thank you, Madam Chair, and thank you to the councillor for the question. I can't speak to the full details of the science because I don't understand the dynamics of how water filtration, etc., happens. But the basic idea is that if you have contaminated water that gets into the lake there, because of the algae, the currents are not able to flow in the same way, and so it does not get cleared out and sent away from the shoreline, and it gets kind of trapped there. And so that is the reason why those adverse test results will persist on when there's algae present.
Right. So many of the councillors are content with the approach that the revisiting of testing at Waverly Beach occur after the issue of algae has been addressed. But one of the councillors has been very actively involved in some private testing by volunteers who then can determine how safe the water is. The reality is that there are still people swimming there. And we've asked our staff to communicate with public health in order to ensure that there's some appropriate warning to the public using this particular beach. If it's inevitable that any testing would result in negative tests, well then, or positive, whichever way you're looking at it, then the public should be made aware of that. There apparently has been an initiative undertaken by an organization called Coastal, or I guess an initiative called the Coastal Collaborative. And that deals specifically with addressing algae in the Great Lakes. I don't know what the region's involvement in that is. Are we involved at all?
So, Madam Chair, I'm not aware of us being involved with the Coastal Collaborative. I can double check with our manager who's responsible for our recreational water programs to double check, and then I'll let you know if the answer is different. In terms of there being appropriate warning for visitors who may be using Waverly Beach, there should be signage up there indicating that it's not a beach that's being tested by public health, and therefore people should, be aware of that risk.
Okay. And then finally, then, if depending on what comes out of the doctor's inquiries about Coastal Collaborative, I believe that we should be involved. We have a significant waterfront on Lake Erie and on Lake Ontario. Any initiative that deals with water purity, I think we should be involved in. So if it's not public health, I don't know, maybe it's a public works area. I would think, though, public health. So I look forward to receiving some additional information. Thank you, Dr. Hergy.
Okay. Thank you, Madam Chair.
Okay, Councillor Bentley.
Thank you, Madam Chair, and thank you to Councillor Gale for raising the issue about medicinal marijuana and also recreational. And for clarity, the new high school is planned to go in Lincoln, but it's right at the Grimsby-Lincoln border. But we're not pleased with it anyway. But this issue is topical in every municipality, and we tried to deal with it last night at our municipality as well. But we had an existing greenhouse that is up for sale. One of the conditions of sale is that it gets approval for medicinal marijuana. Well, we have planning setback rules for medicinal marijuana because we've tried to get ahead of the curve, given that there were no rules come along with this. It was a Liberal campaign promise that unfortunately is coming forward without any support around it or controls. I've only had 3 applications come to me from Health Canada, which we never used to get. It was confidential before. And on all three, I've said I would not recommend them. One, because it was organized crime that started, an illegal grow-up that blew up, and they still haven't paid restitution for all the work that they caused or the danger, but yet they've applied. But the application came through, it didn't come through our planning department this time, it came through a committee of adjustment, which is a separate arm of the municipalities, and you don't have jurisdiction over them. And they granted a minor variance for the setback issue. So given that all of the municipalities are trying to deal with this at the same time with no guidance or rules, I appreciate the question, where do we go? We haven't been successful getting an answer from Health Canada. They definitely do not have enough controls or oversight on the operations. I can't believe that the former chief of police of Toronto, Bill Blair, is the one sort of driving the bus here and figures that this is going to be okay for everybody. It is not. And we're getting the same kinds of concerns. So if we get a report back through planning, I'd actually asked our CAO to put this in the CAO's meeting to try and get a handle on what the Niagara region is doing. So at least we can be consistent in the Niagara region. We're being targeted for a number of different reasons that they're popping up everywhere. We've got 5 illegal grow-ops that we know of, and the police can't do anything with them. So this is a major issue that's not going away, but I would appreciate the report when it does come back from planning. And if Member Badaway, and he's in the government, and I can't imagine him going up against Mr. Trudeau on this issue because it's Trudeau's pet project. But Dean Allison is in opposition, so maybe we can get some common sense coming out of that side and some leadership. Because right now, they have these controls that are part of the approval process, but if there's no oversight to monitor compliance, who's at the mercy? Local municipalities and the neighborhoods. So this is a major issue that is coming far too quickly. It is across the province. Well, you go to FCM, you go to AMO, you go to OSUM, you go to any of those, that's one of the major topics of discussion now. How are you going to handle not only medicinal marijuana, but this wave that's coming? Where are you going to put the dispensaries, as an example? You don't want them in downtown areas or close to schools or close to daycares, but it's a commercial operation. So I don't know if we have anybody from the region who are following the Hamilton scenario, because they've had, I think they've based it on a maximum size of the facility, and that's in violation of their planning bylaw. And I think they're approaching it from that angle, but also maybe is it agricultural or not? And I think someone's trying to get a definition of agriculture for the consumption as food versus agriculture in this vein, so to try to differentiate it. And I don't know where that's going to go either, but it's certainly not a food source, and it's a boatload of money for somebody that's in it, and we're going to pay the consequences. So we share the concerns, and hopefully from the Niagara region we can have a common direction to put forward to all the different parties, provincially and federally. If it's an odor issue that is the Ministry of Agriculture or the Ministry of the Environment to handle, that's provincial. So what is their role in this? Policing, their role from an enforcement, they're in no man's land right now. So it's a major concern for everybody, and I appreciate you, Councillor Gale, bringing that up. Thank you.
And thanks, Councillor Bentley, and I think it's a great idea, your suggestion to kind of come at this as a united front, and the great idea to have it placed on the next area CAO agenda, because 7-8 years ago it was more of a rural municipality issue, but now we're seeing it's affecting everybody. It's not just Waynfleet and West Lincoln, it's all of Niagara, so it's a great idea. Councillor Marshall.
Yeah, mine was on the marijuana issue as well, but I think it's better said tomorrow night or tomorrow afternoon when we have our meeting. But I have informally asked for the very report that we're talking about now. But it's not just the mayors that get the calls. We get the calls, and what do we tell people when we get it? It's hard to direct them to various departments in the provincial or federal government we have to get some answers, and I think this report that should be part of the report, so we know what to do.
Okay, and then, okay, I have Councillor Tim, but Councillor Gale, I'll go back to you if it's on the marijuana. We'll stick with that, and then we'll go back to Councillor Timms. Councillor Timms has a different,
Yeah, one thing that causes me comfort on this issue is there's a plant on Stanley Avenue in Niagara Falls that was being told by residents around, and the Ministry of Environment was investigating because there was sound and smell and things like this, and they says there's no grandfathering on environmental issues. So therefore, plants in place now, if this holds true with something like this, and I hope it would, that there's no grandfathering on a smell from a plant that was built 2 years ago. You have to change if the government says it has to be changed, which would make sense, because I'd hate like hell for a high school to be built and have that smell. So if that's the same case, thank you.
okay, Councillor Timms.
Thank you, Madam Chair, and thank you for taking my question here this afternoon, because I'm not a member of the committee, but at one point I was a member of Public Health and chaired the committee for a while. And there was a long-standing issue, a long-standing goal of public health was to reduce the consumption of unhealthy beverages, sugar beverages. So basically pop. And what raised my concern was that recently St. Catharines has banned the sale of bottled water in city facilities. I understand that. The city is concerned about plastic in the oceans. And I go back to, I'm also worried. I'm worried about sugar in our kids. And that is a long-standing public health strategy or public health concern, is to reduce the consumption of unhealthy beverages. And so what the city's motion was to ban bottled water immediately, and then all beverages in plastic, which is, the goal is, reduce the plastic in the oceans kind of thing. So I spoke to Public Works this morning, suggesting that Public Works should revive an old campaign against litter, because the plastic water bottle is, that gets into the region's recycling or garbage system, never makes it into the ocean. It's plastic litter that makes it into the ocean. And that's where I'm asking Public Works and Council to invest in the old campaign, the war against litter, and not focus so much on the war against water. A couple of councillors at City Council raised that question about this banning plastic bottled water was a war on water. And another councillor was concerned that it was discouraging water and encouraging the sugar beverage. So that's, I understand both arguments, and I'm concerned that the region needs to, or perhaps we could, look at reviving the war on litter. But also, I wanted to ask Public Health, how are we doing on this discouraging the unhealthy drinks versus encouraging water? Because, and I refer specifically to the report from the city of St. Catharines. It says that sparkling beverages or soft drinks represented the highest volume of sales in these facilities, but sales figures are trending lower each year. And their figures also show that the vendor's bottled water brand represented the second highest volume, and the sales figures were trending higher each year. And they also, in discussing with their vendor, they said that the bottled water product would simply be replaced by other products that may include flavored water products. So it sounds like the two were working in two different directions. We're concerned about plastic in the oceans, and I think that's a plastic litter problem far more than a bottled water problem. So my question to Public Health at this point is, do we have any figures that show or reflect the same trend that this report from St. Catharines has come up with? And do you have any comments on how we need to balance this war against plastic in the ocean with the war against water and the war against the unhealthy sugar beverages.
So thank you, Madam Chair, and I'm going to turn this over to Dr. Feller in a moment, who can speak in much more detail around some of the health issues and statistics around sugar-sweetened beverage consumption. To your overall point, it remains a concern in public health, the consumption of sugar, and particularly sugar-sweetened beverages. We have, very high incidence of obesity and diabetes really across Canada and across North America, and sugar-sweetened beverages where people can consume large amounts of this, consume lots of sugar without really getting the feeling of being full because it's all liquid, is a huge driver of this trend. We, of course, are very, sympathetic to the argument that we want to reduce waste. I wouldn't want to comment really more on that and would really look to Commissioner Tripp and others who are experts on the waste side of things to really have comment on that. But we remain very committed to the goal of reducing consumption of sugar by others. I have not seen any particular statistics showing either of the trends that you've really talked about, if it going up or down, but I can say it does very much remain an issue, and if it has gone down at all, it's only very slightly. And I'll turn it over to Dr. Feller to comment further.
Thank you, Madam Chair, and to the councillor. And I apologize and hope this is appropriate. If anybody wanted to get out of here and then you ask us about sugar, we might be here a little while because this is such an important issue. So thank you for raising that. And in fact, probably about 14 years ago, I was at the State Congress House for Maryland having almost the same conversation and holding up 2 liters of pop and talking about what my pediatric population were drinking every day. So I can speak to it a bit. I agree with Dr. Hirji that the recycling aspect of it, we will leave that in the capable hands of Commissioner Tripp. And through the chair, I will say that perhaps this is actually a step forward. If they're going through the recycling angle to start to get rid of some beverages, that might be a good step. On the sugar angle, however, you're correct. We say water, not sugar, but your way. If we've been preaching for 30 years about this and we're not really making headway, there are some data and statistics not local that do show that over time, the consumption of sugar-sweetened beverages, the traditional ones have gone down slightly, but they've been replaced with newer things like energy drinks and newfangled sorts of sport drinks and those sorts of things. From a public health point of view in terms of the data, and I don't know if any of us want to hear this right now, but basically 1 can of pop has about 9 1/3 teaspoons of sugar. The WHO and some of the heart recommendations in the United States recommend that the average adult and children should have 6 teaspoons of sugar. 9.5 teaspoons in just 1 can of pop. That doesn't include the other sugar that's added to all of our foods and everything else that we drink and eat in a day. Something that might be surprising, 8 ounces of regular orange juice, something that is typically regarded as healthy, 5.5 teaspoons in 8 ounces of orange juice. Sports drink, 600 mLs, is going to be about 5 teaspoons. I won't even comment on everybody's favorite specialty coffee from your favorite specialty coffee shop because you don't want to know. The other thing in grade 7-8 data from the OSTIS report that I believe is in the appendix of a report earlier, we're not seeing any improvement in Niagara in terms of the amount that's consumed. The bad news is the amount that is consumed is pretty high, and it's at least 2 or 3 times as high as the recommended amount. So what I will say is we know that preaching does not work and has not worked. Unlike sort of what we've experienced with tobacco, you have to eat. And that's what we always get back when we're trying to approach this. So we need different tactics, and what we have found that works is an entire whole of community approach. So in here we have the Niagara Healthy Communities Challenge. And if it's okay with the chair, we do have a map we could show you quickly. Just in the last year, theme 2 was Water Works Wonders of the Niagara Healthy Kids Community Challenge. Those are new water filling stations that are now available across Niagara. The money was given to each municipality to determine with their school boards, with their community partners, where in Niagara, where in their municipality is there a lack of access to healthy city tap water for their priority populations. So the Healthy Kids Community Challenge in Niagara is one big avenue we're taking because that's the most evidence-based approach worldwide to actually start to make an impact on this. The other piece that I'll mention that has been shown to work would be taxation, which obviously is not going to be a local issue, But at a provincial level, we're certainly working with our partners to look for areas of readiness to explore taxation on sugar-sweetened beverages. Again, the evidence on that is very new. So it's not a clear-cut, sort of slam dunk that taxation is going to improve health, but it's showing a lot of promise. So I hope that's helpful, Madam Chair, in terms of the aspects we'd look at. But I think it's very important that we recognize that education has been done ad nauseum, and it's not enough because some people are saying there's sugar addiction and there's processed food addiction. So I don't want us to pretend that we could just tell people these things and habits will change. It's a whole of community approach. Thank you.
Thank you, Madam Chair. So I think what we need to look at is balancing the approaches. One is plastic in the ocean. We need to reduce that by many means. But the other thing we have to keep in consideration is exactly what Dr. Feller was talking about, is the reduction of the sugar beverages. And one of the St. Catharines City Councilor, I don't think she'll mind me mentioning, is Sandy Bellows. And she's been a hockey mom for 30 years and been in all the arenas all the time. And she raised the question. We have achieved some success in selling bottled water in the arenas. And as the vendor says, the water product is going up, the sugar product is going down. And that seems to me that, as you say, preaching isn't good enough. Some practical implementation does work. And it seems to me that bottled water is has produced results, and it is a better solution than adding a bunch of water, portable or bottle fillers. And the City of St. Catharines is balancing their approach. They're saying, we're not going to ban the bottled water in 5 of their major facilities, because those major facilities, fairly recently built, weren't plumbed up for the bottle filler. So their exceptions are everything except, so they ban it in all the hockey rinks, but they allow it in the Meridian Center, which is the biggest and newest. They allow it in First Ontario Performing Arts Center, the Garden City Golf Course, and the Welland Canal Center Museum, because they don't have the alternative. They don't have the bottle filling stations there. So they're going to allow water in those until they can negotiate with the vendor how to take the water out. And the vendor says right here, he's going to probably put sugar products back in. And then the city is saying eventually no plastic containers, so the vendor is going to put into his vending machines glass or aluminum cans, none of which will ever be water. So I am concerned that we continue to balance this approach with the, get rid of the plastics, but at the same time, remember that we are trying to encourage water. And to me, bottled water has proven to be a very successful shift away from the can of pop with 9 sugar and into buying the bottled water. So I just want to raise that concern. And as I said earlier, I think more of the solution to plastic in the ocean is more a war on litter than a war on bottled water in the hockey rink's vending machine. So perhaps public health could take a look at that. I've asked for the statistics that may be not available, but they're certainly available to the vendor in St. Catharines who's selling it through the machines in at least those 5 facilities and across all the hockey rinks. So just ask that public health have a look at that, and maybe some suggestions about how we balance these 2 laudable objectives. But I'm more worried, frankly, about sugar in my kids, sugar in kids and obesity and diabetes as the most immediate problem. Thank you, Madam Chair.
Okay, thank you, Councillor Timms. So seeing that there isn't any other business, our next meeting will be held on Tuesday, September 4th at 1 p.m. here in Council Chambers, and this meeting is now adjourned.